Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss about the causes of high triglycerides. You all know that triglycerides are the fats which are stored in our adipose tissue, mainly the unused calories. When we are eating calories more than what it is required, the excess of it is stored as triglycerides. These triglycerides are utilized when the body needs it, like in starvation or in between meals during exercise. This stored triglycerides are utilized. The triglycerides are usually present in a body in a range which is below 150 milligram per deciliter. But in certain conditions, you can get a very high triglycerides. And this increased triglycerides poses a major threat to the various organs in our body, including your heart. So here you can see this is the excess triglyceride, and this has accumulated, and here in the belly area this is a visceral fat which is more dangerous, and it is also a part of this metabolic syndrome. So metabolic syndrome is a syndrome wherein you have a collection of disorders, like the patient has this central abdominal obesity, that is excess of fat in and around the stomach, in his abdomen. He will have high blood pressure, hypertension. He'll have a higher blood glucose level more than the normal. He will have low good cholesterol, the HDL cholesterol, and his blood triglycerides also will be high. And this metabolic syndrome is important because these people who are having all these characteristic features, they are at an increased risk of developing diabetes, stroke, or heart disease. So this is a metabolic syndrome. Here the patient is having the central obesity. The most of this fat is deposited around his belly area. He can have hypertension. He will have heart disease. He will have dementia. He will have non-alcoholic fatty liver disease. She can have PCOS. There can be insulin resistance. There can be lipid problems, dyslipidemia, and type 2 diabetes. So here you can see the central obesity. So this triglycerides, I've told you, it should be less than 150 milligram per deciliter. If it is anything more than 150 milligram and up to 299 milligram, it is mild. From 299 to around 499, it is moderate. And if it is more than 500, it is severe increase in the triglyceride, which cause serious threats to our body. And there are various causes for this high triglycerides. One is excessive intake of calories, that is excessive intake of high fatty food, high carbohydrate rich food, sugary foods, etc., wherein there is increased calories, and decreased burning of those calories happens when there is a sedentary lifestyle. Patient is consuming alcohol excessively. There is he is having a certain kidney problem. There has been hypothyroidism. There is a liver disease. There are genetic disorders. There are certain medications which can increase the triglyceride levels. First cause of increased triglyceride would be your diet, which is rich in sugar, saturated fat, and simple carbohydrates. So consuming excessive amount of sugars and simple carbohydrates, like you are having increased amount of sugary drinks, soft drinks, refined grains, maida, etc., that can lead to increased blood triglyceride levels. If you are having a diet which is rich in saturated fats, like in fatty meals, you are having full fat dairy, you are having they can also increase your triglyceride levels. You are having increased amount of trans fat. Trans fat is usually seen in the processed food. So packeted foods, unhealthy fat, that can raise your triglyceride level. So when you are eating fried foods, like in our Indian diet, when we say, like you are having fried snacks like pakoda, samosa, street food, etc., which are high in saturated as well as trans fat, you are having it in an excessive amount, that can cause this rise in triglyceride. You are having increased amount of full fatty milk, increased amount of cheese, butter, which are high in saturated fat, they can increase your triglyceride level. You are having refined carbohydrates, like you are having white bread, you are having maida, refined flours, they can spike your triglyceride. You are having sugary desserts, sweets, sweetened beverages, excessive sugar, that can also increase your triglyceride. And processed meat, sausages, etc., that can cause a rise in triglyceride. Certain desserts, like you are having excessive kheer, rasmalai, etc. So all this, when you are having it in excess than what you are burning, that will become triglyceride, and that can spike your triglyceride levels. The kind of foods which can increase your triglyceride would be your saturated and trans fat, bakery item, packeted items, your pastries, etc. Alcohol can increase your triglyceride. Your sugary items, your refined grains, starchy foods, your high calorie foods, donuts, pizza, burger, candies, french fries, all these in excess can spike your triglyceride levels. So food to avoid if you are having high triglyceride would be the sweetened drinks, your aerated drinks, your bread, your biscuits, your bakery items, fruit juices which are rich in the sugar, cookies, cakes, alcohol, candies, ice creams, pizza. All this, when you are having it in excess, can increase your triglyceride levels. Second important reason which can impact your triglyceride is your sedentary lifestyle. You are not moving, or you are not active, you have no exercise, and you are consuming more calories than it is required, but you are not active at all. You are very sedentary life which is going on, and that can increase your triglyceride level. So there is reduced energy expenditure. When you don't move around, when you're not active, your body doesn't burn as many calories that is required, especially when you are doing that from your carbohydrates, excessive carbohydrates, sugars, etc., and they will be converted into triglyceride, and they will be stored as fat, and your TG will increase. When there is lack of physical activity, that can affect your body process of handling the fats, etc., so including the way the body handles your triglyceride, and that will lead to buildup of the triglyceride in your blood. There is increased risk of obesity when there is a sedentary lifestyle, and also sedentary lifestyle can decrease your good cholesterol, that also can increase your TG. Third important cause of increased triglyceride would be your obesity. So there is excessive body fat and free fatty acids. So obesity means there is excessive fat, and when there is excessive fat, there is increased free fatty acid, and this fat is available, free fatty acid is available from the excessive fat which is stored. So whenever there is free fatty acid, that is taken up, the body converts, liver converts it into triglyceride, and that will be circulating in the blood. Your TG will increase. The increased production of TG occurs when you are obese, and the obesity is also an important component of your metabolic syndrome, which is a mixture of or cluster of conditions like high BP, high sugar, abnormal cholesterol, high TG, etc., which will increase your risk of heart disease as well as stroke. Excessive alcohol consumption can also increase your TG. How does that alcohol do this? Because alcohol has a lot of calories, it has sugars that it will get converted into triglyceride. Your body converts it into TG, especially when you are drinking excessively. It will interfere with your fat breakdown. Alcohol can impair your body's ability to break down the fat, contributing to increased TG. It can cause fatty liver, so that can lead to buildup of fat in the liver, potentially causing liver damage, inflammation, and impairing the lipid metabolism, because liver is very important in this lipid metabolism. Increased TG can particularly increase the risk of pancreatitis also. Whenever you are having consuming increased alcohol, that will also increase your risk of pancreatitis, and increased TG can be one of the reason to cause this pancreatitis in alcoholics. Unmanaged diabetics. So what happens is when the body is unable to use this insulin effectively, like it happens in insulin resistance, the fat metabolism gets disrupted, leading to an increase in triglyceride in the blood. I've told you that insulin inhibits lipolysis, so there is impaired lipolysis and the triglyceride deposition keeps on increasing. So whenever there is unmanaged diabetes, there is increased risk of diabetes because these elevated triglycerides, particularly when they are combined with other risk factors like blood pressure, increased blood pressure, obesity, low good cholesterol, etc., they will increase your risk of getting type 2 diabetes. And high triglyceride can be a sign that your body is not using insulin properly, and potentially it can lead to pre-diabetes and eventually end up in type 2 diabetes. So the unmanaged diabetes also can increase your triglyceride levels. Next, you'll see that any liver disease. Triglycerides are the most important type of fat in your body, and the liver is an important organ which plays a role in the metabolism. So when triglyceride levels are high, excessive fat can accumulate in the liver, leading to what is called as hepatic steatosis or fatty liver. So this non-alcoholic fatty liver disease is defined as a hepatic steatosis without any secondary cause like excessive alcohol consumption or any medications, hereditary disorders, etc. That we call as non-alcoholic fatty liver disease. So you can see the fatty liver here. This is a normal sponge like healthy liver. So how TG will contribute to non-alcoholic fatty liver disease? TG, especially in the context of other risk factors like obesity, diabetes, and insulin resistance, etc., they will affect the liver's ability to process fat, and that can cause dyslipidemia. And this fat buildup, if it is not treated, can lead to inflammation and damage the liver. So this is a healthy liver and this is the liver with increased fat cells. Hypothyroidism can also increase your triglyceride level because thyroid is an important hormone which will regulate your lipid metabolism. So whenever there is low thyroid, it will impair the metabolism of cholesterol and triglyceride. It basically impairs the clearance. So that is why TG increases, and it can also lead to increased cholesterol absorption in the gut and reduces the LDL cholesterol clearance. That can also lead to dyslipidemia. So the decreased metabolism of cholesterol and triglyceride in hypothyroidism leads to elevated levels of both cholesterol and TG in hypothyroid patient. So the hypothyroidism patients who are having hypothyroidism, they have increased bad cholesterol, they have increased TG levels, and can also have a low good cholesterol levels. Chronic kidney disease also, there can be increased TG, and increased TG can also cause chronic kidney disease. So studies have indicated that increased TG is a common feature of this chronic kidney disease, and the levels keep on increasing as the disease progresses, the chronic kidney disease progresses. So dyslipidemia, which is characterized by high TG, low good cholesterol and altered lipoprotein composition, is a significant risk for cardiovascular disease, and that can also cause death or it can also worsen the chronic kidney disease. This high TG are associated with an increased risk of developing chronic kidney disease and decrease in kidney function. So people who are having high TG are more likely to experience a decline in the kidney function compared to those who are having low TG. And elevated triglyceride reduces the HDL and can be an independently associated risk associated with this onset of advanced chronic kidney disease. How it does that? The dysregulation of lipid metabolism can lead to inflammation in the kidney, damages the kidney, and accumulation of TG-rich lipoproteins in the kidney can interfere with the kidney function and cause kidney damage. And also the increased TG can affect the renal vessels, and they can also affect the blood supply to the kidney. Familial hypertriglyceridemia is another cause for increased TG, and this is a genetic disorder. It is an autosomal dominant trait. That means one parent carries this gene. There is 50% chance of the child inheriting it. So this can also lead to increased triglyceride. Certain medications like thiazide diuretics, beta blockers, antipsychotics, antiretroviral medicines, hormone therapy like your birth control pills, estrogen, they can rise your TG level, corticosteroids, retinoids, certain immunosuppressants, they can also increase your triglyceride levels. Smoking is linked to higher triglyceride levels because it will lower the HDL, it will affect the clearance of this TG, increases the LDL. So the effect of smoking on TG and other lipids is that even after quitting smoking, the effect of the smoking persists on TGs. Inflammatory arthritis like rheumatoid arthritis, etc., they can also alter the lipid metabolism. So chronic inflammation, which is a hallmark of this rheumatoid arthritis, autoimmune disease, all these things can also disrupt the body's normal lipid metabolism, and inflammation can lead to increase in the production of VLDL, which is very much rich in TG, and this can also decrease the clearance of this lipids, resulting in increased TG. And also there will be decrease in good cholesterol level whenever there is this chronic inflammation like rheumatoid arthritis or your autoimmune diseases. Few risk factors which lead to increased triglyceride level, like if there is a family history of high cholesterol or high triglyceride, women who have attained menopause, in pregnancy the triglyceride level can rise up, HIV, lipid metabolism disorder, if you are inherited some lipid metabolism disorders, all this, your ethnicity, all this can also increase your risk for developing high triglycerides. These were few of the causes which will lead to increased triglyceride level in your body. One is your poor diet. If you are having excessive calories, high fat, high sugary, high carbohydrate rich food, there is lack of exercise, there is sedentary life, there is obesity, there is unmanaged diabetes, there is insulin resistance, there is renal failure, chronic kidney disease, hypothyroidism, certain medications, and yes, of course, genetics can all lead to increased triglyceride level. Thank you so much for watching the video. Please like, share, and subscribe the channel. Thank you.